Hello everyone, I will be presenting on the topic of in premature neonates in a NICU, does receiving skin-to-skin care for at least 60 minutes per day compared to those not receiving skin-to-skin improve the stress levels of the parent/caregiver? So a little bit of background on this topic. Skin-to-skin care is also known as kangaroo care. The two terms are used interchangeably in healthcare, and it's the bare skin contact of a caregiver and an infant. Skin to Skin was first introduced in 1978 in Colombia, which at the time was limited in its resources, and Skin to Skin was used by healthcare professionals as a means to cope with shortages of isolates. For those that are unfamiliar, isolates are a type of bed used in a NICU that helps regulate temperature of particularly premature infants. And so they found through research that skin to skin was a way that mothers, in particular, at that time, could provide warmth from their skin to their infant to help regulate their temperature. Over time, however, hospitals nationwide have incorporated this concept into their practice, and evidence based practice has shown that skin to skin regulates breathing, heart rate, and temperature in neonates. So, my PICO question is population is premature infants in the NICU. The intervention is skin to skin care for at least 60 minutes. The comparison is infants not receiving skin to skin, and the outcome is improved stress levels of a parent/caregiver. So the reason why I found this topic to be interesting is in the past there has been a lot of research done on neonates and how skin to skin care is very beneficial for babies. However, for the parent and or caregiver, not much research has been done. So I thought this would be an interesting topic. So for my research, I use PubMed and Google Scholar, and both of those sources were used to conduct research, and I reviewed articles, including systematic reviews. The keywords I used for the search were premature neonates, parents in the NICU, emotional stress, cortisol, oxytocin, kangaroo care, and skin to skin care. So I have attached a couple of tables down below, and I'll just zoom in on them to help you look at them a little bit closer. So each table goes over oxytocin, cortisol, and anxiety levels in both mothers and fathers in the NICU, and it goes throughout the duration before skin to skin, during skin to skin, and after skin to skin. So just an analysis of the tables. Each one shows that while the parent is performing skin to skin, their oxytocin level, which is relaxation, they tend to be more relaxed. Cortisol level, which is a stress hormone that helps that is produced in our body's response to a stressful situation. It in each parent it tends to be decreased while they're performing skin to skin, and also their anxiety levels, which is at the very bottom right here. Both the mother and father have decreased anxiety levels compared to before skin to skin and after skin to skin. And that could be whether they're like experiencing or watching their infant having an IV inserted, for example. That could be a stressful or a stressor in a parent's life, or insertion of a feeding tube, such as the nasogastric or orogastric feeding tube. That can also be a stressful situation due to discomfort and pain experienced by their baby. So, if I were to go forward in this research, I would go about it by first assessing the parent and or caregiver and the infant's vital signs before and during skin to skin. I would particularly focus on vital sign components such as blood pressure, heart rate, and pulse. Because our blood vessels tend to constrict when we're in stressful situations. So typically there would be spikes in, for example, blood pressure and heart rate. The dependent variable would be the length of time of skin to skin care in my study, and I would ideally like to use a sample size of 35 parents and infants in a NICU facility. Of course, I would need additional funding in order to go forward in doing my research, as well as I would need the IRB to be involved because in this case, my study does include human subjects of babies and parents or caregivers. Thank you so much for listening to my presentation.